So what is this IVF? Who requires this IVF? Is first we need to know that. So today I'll be talking about what is the ideal time to start IVF or ICSI procedure. Hi, I'm Dr. Chinmayie, consultant, infertility specialist and gynecologist at Garbhagudi IVF Center, South End Circle. A technique wherein those who have difficulty in conceiving through natural methods or through simple treatment, it's a boon for most of the infertile patients, where the oocytes of a woman is taken outside of the body and then the sperms are taken, both are fertilized in the laboratory, allowed to grow into embryos, that is the early stage of the fetus, in the laboratory for up to 3 to 5 days, and then it is transferred into the uterus of the woman for further growth. So this procedure is called as IVF procedure. So to know when is the ideal time to start, we need to know what are the causes, who requires this IVF first. Those women who, both men and women, both abnormalities is an indication for IVF. But what are the specific causes which require IVF? In case of females, when they have tubal factors, so there are these fallopian tubes on both sides of the uterus, which is very important for a natural conception. Suppose if these tubes are blocked, or it is non-functional, or due to some surgeries it has been removed, such women cannot have their natural conception and they require IVF. Similarly, those who have severe endometriosis, in case of reduced ovarian reserve, where the ovarian function is reduced, in case of multiple miscarriages, they have a known genetic disorder in the family and they want it to be prevented in the fetus, or in case of males where there is no sperm count at all, called azoospermia, or in those who have a severe reduced count, the motility of the sperms are very less, where the count is less than 5 million, motility of the sperms are less than 10%, or the normal structure of the sperms are less than 1%. So all these are various conditions who require IVF treatment. Or those who have undergone many failures of IUIs, intrauterine inseminations have failed multiple times, 3 to 4 times they've tried and it has failed. Unexplained infertility. So all these women, couple do require IVF. So when should they start? Should they start immediately, or do they have time? Is there a time frame for anybody to consider IVF is what we need to know through this episode today. So if we see, it all depends on the cause for which the IVF has been suggested to the couple. Suppose if a woman has presented with low ovarian reserve and where it has been suggested for her to undergo IVF, she needs to start it immediately. For this, I would like to quote an example where a couple presented to us, where she presented to us when she was about 32. At the age of 28, she had consulted another doctor where her AMH was found to be around 0.9 and she was told to undergo IVF immediately. But many people have this conception in their head saying that I'm only 28, 26, why should I undergo IVF? It is a major procedure, not required, or maybe I'm just married for 1 year, it might not be necessary. There's nothing like that. If it is required, it has to be done. So what happened when she came to us after 3-4 years later at 32, her ovarian reserve had dropped down further. So that's the reason the doctor had told you need to start it immediately. So when she came to us, her AMH was only 0.5. So it had drastically reduced. So her chances of conception, even through IVF, will reduce when the ovarian function reduces further. Similarly, if she had done IVF, she would have conceived with 1 cycle, but now she might require 2 cycles. So like this, the problem will go on adding on to it, not by just waiting, you will not solve the problem. So whenever it is suggested, especially for low ovarian reserve, it has to be planned immediately. The very next cycle it can be planned. Second thing is in case of endometriosis. Many people who come who have had the endometriosis is a condition where there is a cyst formation within the ovary and blood gets collected within the cyst. So they would have undergone surgery, and in such people, especially when there is a grading system like minimal, mild, moderate, severe form of endometriosis, those who have moderate to severe, or even in case of mild form of endometriosis, when it is associated with tubal factor, they have to go for surgery immediately. They have to go for IVF immediately after surgery. Or if it is a moderate to severe, irrespective of the age of the woman, irrespective of the male factors, irrespective of her tubal status, she has to plan for her IVF very next cycle of the surgery. So it is not like we do surgery, wait for 2-3 months, couple of months and then plan for IVF. This is because when this is a condition which is known to recur. and it recurs. For some it might recur in 3 months, for some it might recur in 6 months. So when we do it immediately after the surgery, the chance of conception is maximum. So therefore in endometriosis, it's immediately after she's undergone a surgery, a laparoscopy for adhesiolisis or endometriotic cystectomy. Then in case of tubal factor, of course there's no point in waiting, because with waiting the only thing is the age will increase, the success rate will reduce. Therefore, one thing we need to know in IVF is age is also equally crucial. Younger the age, higher the success rate. This is because as age advances, as woman crosses 30-35 years, especially 35-year mark, there is a drastic reduction in her ovarian reserve. Plus, there is something called natural process where we all know we have 46 chromosomes, out of which 23 comes from egg, 23 comes from sperms. So this division from 46 to 23 in the eggs takes place at the time of ovulation. Once the woman crosses 35 years, with increasing age, there is chances of getting an abnormal, genetically abnormal eggs, which don't have the capacity to lead to pregnancy. So that risk will go on increasing, which cannot be controlled. So therefore, her success rate or chance of pregnancy can reduce. So if a woman at 30-35, she undergoes IVF, her success rate is around 55 to 60%. Whereas somebody around 40, it is around 35 to 40%. Beyond 40, it is again around 30%. So age plays a crucial role. If it is necessary, it has to be done as early as possible. For some women, where it is indicated, maybe she's undergoing some ovarian surgical procedure, or in case of malignancy where a particular ovary has to be removed, for them we say you need to undergo immediately, meaning the very next day, irrespective of her cycle, whichever day of the cycle, we start immediately, and that is called random start. Otherwise, for those who we are starting electively, it can be started IVF from the second day or the third day of her periods. So like this, we're depending on what is the cause and why it has been suggested, the IVF will be planned. For more or less, when we are doing an elective planned IVF procedures, it will be started from second day or third day. And once it is suggested, it has to be planned as early as possible, because lesser the age, earlier the IVF, better the success rates. So considering all these things, one can decide which is the best time for her to undergo an IVF procedure. If you've understood the IVF procedure, how it goes and when it is necessary and what is the ideal time to start. So if you've liked this, you can always like the page and share this information with your friends and family who requires this. And for further information, you can always subscribe to our channel. Thank you.